Hello, welcome to Natural Health Today. I'm your host, Dr. Stephen Blomerth, and this show is dedicated to your health concerns, questions that you might have about yourself, family, or friend, because I have found in my 37 years of practice that common problems, and probably 80 to 90% of day-to-day problems that people have, don't require drugs, don't require surgery, and can be helped by natural health care. So we invite you to participate in the show and send in your questions to the show. We have 3 different ways you can send in your questions. One way is by sending an email to bbdchiropractic@gmail.com, or you can telephone my office at 978-535-6155, or you can send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. But whichever way you choose to participate in the show, we'll be sure to disguise your name just a little bit so your friends won't know the nature of your health concern. And we'll talk about natural health ways that often get most people better. And when I talk about natural health, this is what I basically think of as the 4 avenues of natural health. One is the approach where we manipulate or free up stuck joints. When you have a joint that's stuck, whether it's in your neck, your back, your foot, your hand, it causes at first pain and later stiffness, but it can also radiate to other areas and cause you to have, if you have a problem in the shoulder, you may end up with the pain in the wrist. If you have a problem with your feet, you may have pain or dysfunction in your knee. And so when you free up a stuck joint, it has many times far-reaching positive effects. Another aspect of natural health is muscle work. And I don't think of muscle work as just simple massage therapy. I think of it as the intelligent application of knowing what muscles do what action in a person, testing to see if that action is limited or painful in a person, and then doing what we call trigger point work or myofascial release to free up not only the muscle but the fascial coating. It's this long coating that runs from muscle to muscle and connects us all in this chain from our feet up to our head. And the third avenue of natural health that I talk about is exercise. And I'm not talking about working out at a gym. That's usually not helpful for most people. And I'm not talking about things like dancing or running. I'm talking about stabilization exercises. I've done all the different other exercises approach in my many years of practice. I found that the stabilization exercises are good in terms of making you stable. Now, do I do some other types of exercise? Sure, I do. I run, I play tennis, I bicycle, I do some pull-ups. But the stabilization exercises I look at as my basement level of making myself stable so I can do all the other things that I like to do and participate in all the other sports. And the fourth, but not the least of all the 4 aspects of natural health care, is nutrition. And I'm not talking about what vitamin supplements you have or you may take, although that can be a part of good nutrition, but what do you eat on a daily basis? And sometimes it's not only what you eat, but what you don't eat, because some people may take vitamin supplements that seem healthy, but they have a terrible diet, and a supplement can't make up for a bad diet. So we talk about ways to change your diet, because diet is more than just whether you're normal weight or overweight. It also has to do with how well you sleep and how well you rest. So those are the 4 basic avenues. Send in your questions to us, and I'm going to put on my reading glasses now and look at some of the questions that have come in since our last episode. Okay, Adrienne writes in from West Peabody. She says, 3 years ago I reached high over my head to put away a box of Christmas decorations, and ever since then I have a constant pain in my right shoulder and some pain that goes down into my right hand. I went to my primary care doctor and 3 other doctors. I got x-rays and exercises and at physical therapy And none of the things seem to work. So no one has fixed my problem yet. So tell me, how come the pain won't go away since they all said it's, quote unquote, nothing serious? Well, for one thing, Adrian, you got to remember that when a medical doctor says something is not serious, it means it's something that's not going to kill you. You're not going to keel over from it. So that's their idea of serious. But I have a different idea of serious. My idea of serious is something that bothers you. Like Adrian says, she had constant pain. If you have constant pain, living with the constant pain, it really drags down your overall energy. It drags down your the things that you want to do and things that you can do. So just because something isn't going to kill you and is quote unquote not serious doesn't mean it can't be a problem that should be fixed. So Adrienne has been to several different doctors, had x-rays, MRIs, different tests. She hasn't received any help. So what could she have that may cause her pain in her shoulder? And when I say shoulder, I mean right here. But most people may mean here, here, or on the back side of your shoulder blade. There just so happens to be a trigger point on the back side of your shoulder blade. If you reach back here far enough, you can touch different muscles that make up what we call the rotator cuff. And the rotator cuff muscles help stabilize your shoulder. And I could easily see that if a person was reaching high up over their head with a box of Christmas decorations, I don't know if they're heavy or not, but just being in that position can be, for some people, a disadvantage, because when your arms are up like this and you have a weight at the end of them, it's a long lever arm. So let's just suppose that perhaps Adrienne has a round-shouldered, head-forward posture like that. That puts your shoulder at a biomechanical disadvantage. So even though it doesn't sound like an activity that would be that dangerous or that much of a strain for the average person, it could be enough to set off a trigger point pain. Here's the stories about trigger points. Trigger points don't have a termination date. In other words, they don't stop hurting after a week, 2 weeks, 3 weeks. Best case scenario for a trigger point is that they may become latent. They may go from hurting you constantly to just hurting you if you provoke them. But if you have a round-shouldered posture and you have a trigger point, yeah, that point that I mentioned in the back of your shoulder, that can give you pain all the way down into your hand and into your fingers. And so very commonly when people have a trigger point back there, they don't necessarily feel that all the time. And if you go to your medical doctor, he'll say, well, you got pain down into your hand, you must have something wrong with your wrist or your neck. Those are possibilities. But if Adrienne has been treated for 3 years, they've probably may have treated some of these other areas. They may have treated here, they may have treated here, but they didn't treat back there, which was the source of the pain. The easy way to find out whether a person has pain in that area is just, say, do an activity that might bring out their pain. Press back in that area and see if that brings out the same pain. If that brings out the same pain as the loss of activity that they have, like raising your arm up like that, bingo. So that problem needs to be addressed. So Adrienne, if you haven't had the type of care that has addressed your problems, you still can be helped. It's not that no care will ever help you. You just have to receive the right care. So I would recommend chiropractic manipulation of the shoulder joint, wrist, hand, perhaps neck, but also addressing that trigger point that may be a factor. Is that a factor or not? Who can tell unless you examine? But many times trigger points, particularly on the backside of our shoulder blade, are not diagnosed. No one thinks to go there. I think to go there because I know how bad that pain can be. I got pain in that area once myself when I fell on it cross-country skiing. Adrienne, thanks for that question. And let's go on to our next question. Okay. Mike writes in from Danvers. He says, 2 years ago, I was in an accident. I was hit from the side and thrown across the seat of my truck. I think I was lucky not to have a seatbelt on. I did hit the driver's side door, and it's killing my back down into my right butt. I went to a physical therapist and a chiropractor, and they haven't fixed it yet. Any ideas? Well, sure. So let's think about Mike's accident. He said he was driving, and he gave away that he was driving a truck. He wasn't wearing a seatbelt. Was hit from the side. And he said he was pushed until he hit the driver's side door, okay, way over to his right. So it's quite possible in sliding across there that he may have hit the cheek of his butt up against the driver's side door. If you hit the cheek of your butt, there's not only a muscle on the outside, that big muscle that we all have called the gluteus maximus, but there's several muscles underneath that. And underneath that big muscle, the gluteus maximus, there's a muscle called the piriformis. That piriformis is a small muscle. It actually derives its name from the Greek word for pear, piri. So that pear-shaped muscle, it runs from your hip bone all the way to the underside of your tailbone. And that muscle can, since it runs from your hip to your tailbone, can affect your tailbone, so it means it can affect your sacroiliac and therefore your back, and just the way it's situated, your sciatic nerve runs right either under it, through it, or on top of it, so it can affect your sciatic nerve as well. Sometimes when people say they have a pain in the back, the doctor won't necessarily check down in your buttock area, but I always check that area because it's a common area to have a problem with your piriformis muscle. If that muscle hasn't been treated and you've been going to physical therapy for a while, if you had the accident last year, you still need help. It can be helped by a variety of techniques, including some direct muscle work, but it has to be right on the muscle. It means your practitioner has to know how to find the muscle, locate it, treat it, and make the muscle pain go away. But also you have to know that since that muscle attaches over to your tailbone, and your tailbone is part of your sacroiliac joint, you probably need to have your sacroiliac joint manipulated to free it up so it'll work the way it's supposed to do. So Mike, thanks for that question. Even though it happened a year ago, until you get adequate treatment, some of these conditions just won't go away on their own. Okay, Maria writes in from Danvers. She says, last summer I had surgeries for my kneecaps. I love to ski and I love to walk, and I just couldn't do it anymore because of the pain. They said it was bone on bone, so I had them done, but now I'm worse off than before, and I wish I had never had it done. They said that the problem now is scar tissues build up, and I could have another surgery to get rid of the scar tissue. What should I do now? Just a quick recap on Maria. So she had pain in her kneecap area. Kneecap is right about here. The fancy word for the kneecap is the patella. And the patella, it looks like a giant sesame seed. That's its shape. And it has a muscle that runs through it called the quadricep, and it goes through the patella, and it plugs down here, just at the very top of your tibia. And it actually glides back and forth on your femur. Your femur is this thigh bone here. Patella glides back and forth, and the basic function of the patella is to make your quadricep stronger. And what does your quadricep do? It straightens your leg out, holds your leg out straight. So it's an important part of walking. If you have a problem in your patella, you can have pain in the knee. It actually is, of all the different pains you can have in your knee area, that's one of the easiest things to treat. How frequently does it need surgery? Almost never. What can cause your patella to hurt? You could have a flat foot, because when you have a flat foot, your foot rolls in, your shin rolls in, and it makes the patella, the kneecap, track to the outside edge. When it tracks to the outside edge, it wears more on the outside edge. It gives you pain when you walk. And usually pain in the patella area hurts more going downstairs than coming up. It can hurt in both directions, but going down is usually harder. How would I treat it if a person came into my office? Well, I would have a look at the whole person. I would look at their feet. I would look at their hips. I would look at their sacroiliac. But I might do some soft tissue treatment, because I bet that before she even had her surgery, she probably had scar tissue built up in there before the surgery. Now, surgery creates scar tissue because when you cut something, the body responds by making a scar. So she had scar tissue in there. They did surgery. Who knows what the heck they did? They didn't take out any scar tissue. They made more. How do I know? She feels worse than she did before the surgery. So she went in there for a problem. They did surgery, and now she's worse. And now they're suggesting, well, let's do another operation and take out the scar tissue. No, surgery only creates more scar tissue. What would I do? I would do some hands-on techniques. I would make orthotics for her feet if they're flat. I would give her exercises because many times when people have that type of a problem, they tend to walk with their feet toed out. They tend to walk with their feet in external rotation. I would give her some exercises to learn internal rotation at her hip joint. And I would do hands-on scar tissue work by just going back and forth with my fingers or a small instrument to break up it from the outside, where you're not actually breaking the skin. If you don't break the skin, if you use your hands, if you use the right amount of force, which is a bit like cooking. You can't use too little, you can't use too much. If you use the right amount of force, and how do I know when I'm doing it right? I have the patient do something that might aggravate them, like say, go up and down some stairs at my office and see how it feels before the treatment. Treat the patient, have them immediately go back to those stairs, go up and down those stairs, and if I'm successful, they should immediately feel some reduction in their pain. And I'm not talking about a reduction from getting a shot or Novocaine or something false, phony to cover up. I'm just talking about hands-on techniques, free up that area, restore function. If you restore function, the person should have immediate improvement. All the way improvement? No. I'm not talking about all the way improvement, but some increase. And so if you gain a victory there, next time you come in, you know you're on the right track. You repeat that, and what you want to see is a little bit of improvement time after time until the patient is as good as they're going to be able to get. That's the correct way to treat people. If all of that fails, then you can opt for surgery. But you don't do surgery first and then say, oh, we'll try to get out the scar tissue later. Unfortunately, Maria her surgeon put the cart before the horse, cut on her knees, made her worse, and now they're saying, do another scar tissue. I wouldn't have that surgery done until I went to a person who was skilled in treating the whole person, not just the knee, because you don't just treat the knee. You have to treat the foot, the hip, the sacroiliac joint, because she's an active person. She likes to walk, she likes to ski. You want to return to those functions, and it's likely that she wasn't that much out of shape. She was probably not an out-of-shape person if she could do all those things, walking and skiing. So it wasn't from being out of shape. It was just if something was wrong, her activity levels caused her pain, her treatment caused her more pain, so now we have to do something to restore normal function so she can get back to doing what she likes to do and not be in pain and not have more scar tissue. That was a good question. Thanks for sending that in. Let's go on to our next one. Okay, Jackie writes in from West Peabody. She says, I work as a hairdresser, and I always feel tight at the base of my neck and my shoulder blades by the afternoon. And that's when my headaches start about 2 o'clock. I think they're related, but my headaches are in my forehead, kind of right up over my eye and in my forehead area. Are headaches just from tight muscles like mine? Jackie, the short answer to that is they can be. Not every headache is from tight muscles. For instance, migraine headaches they're a type of headache that is not fully understood, but they think that it has to do with blood flow. But many people or understand the difference between a migraine and a tension headache. Many people call an intense, painful headache a migraine. It's not. A migraine has certain characteristics. One is you have a little bit of a warning or a premonition that the migraine is coming on. Another is that you're sensitive to light. Another is you'll get little disturbances in your visual field, little floaters, or like an aura. You'll see the outline of a person, and maybe you'll see like a projection or a rainbow up above that person. It's kind of an outline around people or things that you look at. And you're sensitive to light, so you feel better that you want to lay down in a dark room. Those are characteristics of a migraine. You can have a very intense headache and not have it be a migraine. So just don't think that if you have an intense headache, it's migraine, because migraines are in the minority. The majority of headaches that people get are tension headaches. Does that mean you had to feel tense? Doesn't mean you had to feel tense. It just means you were doing something like a hairdressing. Person is standing, they're bending over all day long, they're getting in certain positions, they're reaching, they're doing that. There can be 1,000 different reasons behind it. But she gave a certain evidence. She said she tends to feel tight at the base of her neck every day, and then later on in the day she'll get these headaches. When you have a problem in this muscle here, this muscle is called the trapezius. The trapezius can refer pain and give you pain in this type of a pattern, up over the top of your head and over your eye like this. It's kind of like a big question mark. So trapezius area headache pain patterns, very, very common to have it over the eye. If you feel tension in your neck area every day, it's likely to be a tension headache. Will it go away if you take pills? It might go away if you take pills, but the pills don't address the cause. The cause is likely trigger points in a muscle, some stuck joints in your neck or upper back. It can even be due to having a flat foot or something off in your low back, because people are building blocks. They're one bone and one muscle on top of the other to make a whole coordinated effort that allows you to walk around and function. If one part of that chain is off, it can have the symptoms in many distant related parts of your body. So what's the fix? Have an examination, see if you're having trigger points that are causing your headaches. Get some simple chiropractic care and trigger point and muscle therapy, and learn some exercises to improve your posture. The more steady and more stable you are by knowing the right exercises, you can do things. Hairdressing seems like an easy job, but a lot of people do it and report that type of headaches. Having been in practice as long as I've had, I've seen it, I've heard it. It's not just hairdressers, it's anybody who works on their feet and has to bend over. So it could be plumbers, it could be nurses, it could be dental hygienists, it could be dentists themselves. So thanks for that question. Your headache pain, likely to be a tension headache, and getting some good care, it's likely that you can make that go away so that you don't have that day-to-day constant tight feeling in the back at the base of your neck. Thanks for that question. Let's go on to our next question. Okay, Shirley writes in from Denver. She says, my brother saw a show about chiropractic on the internet, and now he wants to crack my back, but I won't let him. Should I? He says he already tried it on his friends. Okay. But you know, these days you can see just about anything on the internet. It doesn't mean that you're a qualified practitioner. Could you get hurt? Maybe. But the thing is, why you wouldn't go to someone who saw a show about dentistry on the internet and said, well, let me try to work on your teeth. No, you'd say, why don't I go to someone who's qualified and experienced and who knows what they're doing? Generally, chiropractic care is safe, but knowing the right time to use it and when not to use it is also important. That's why when people come to our office, we don't just have them lay down and start poking and prodding them. We examine them. We go and do a thorough health history. We see what kind of conditions they may have had. We'll take some x-rays in an area to find out, gee, is it safe to do manipulation in an area? There are some few people who are born with alterations from the normal where things could be too loose. They might have a bone or two in their neck or their back that's not fully formed. It hasn't bothered them, but to have manipulation in an area that's not fully formed or has some type of deformation or even the potential for disease in an area is not wise. That's why we take an x-ray in an area to not to necessarily totally know what the problem is, but to rule out, do we have to be cautious? Because caution is always a good idea. And a person who saw a show on the internet about chiropractic even if it's your brother who would have the best of intentions. You don't want to be hurt, and your brother doesn't want to hurt you. So I'd say, even though he got away with doing some of these things with his friends, let's just say, save it for later and go to somebody who is qualified and get the care that you need from a certified practitioner who's licensed by the state, so that you get the best relief you can. So those are our questions for today's show, and I want to thank you for watching. I'm Dr. Stephen Blomerth, and the show you're watching is Natural Health Today, and we talk about your problems. You send in your questions, and we talk about ways that you can help yourself get healthy with the right type of care. There's 3 different avenues. You can send your questions in via email to pbchiropractic@gmail.com, or you can telephone my office at 978-535-6155. You can send an old-fashioned snail mail handwritten letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts 01960. Whichever way you choose to participate in the show, we'll disguise your name a little bit so your friends and neighbors won't know exactly the nature of your inquiry, and we'll talk about some natural health ways to help get you better and keep you staying better and staying healthier. So thanks a lot for watching. I'm Dr. Stephen Blomerth. Bye till next time. Bye-bye.